Helen Webberley is back in the news, causing chaos over trans children again. Well, trans children, I should say. This time she was on GB News discussing her gender GP company that is based in Singapore and is now branching out to the US. If you do not know who she is, then let me fill you in. She was a doctor here in the UK. She is now no longer licensed to practice because she failed to renew her license, and there was probably other things going on. I don't know though. I can't confirm that. However, I can confirm she did not renew her license. She made headlines back in 2017 when she was restricted from treating transgender patients unsupervised when she gave cross-sex hormones to a 12-year-old and 3 15-year-olds when the guidance at the time was 16 years old. That article is linked below for you. Things got heated when she went on GB News, and it only got worse from there. Hello and welcome back to Chat About It, Don't Shout About It with me, Rachel, the Queen of the Woke, as crowned by one of my haters.
I crown you Queen of the Woke!
Let's chat about it. Have you seen what is going on with Helen Webberley and GB News? Let me know in the comments section below what you think about it. Helen Webberley goes on GB News to discuss gender GP, and she has a debate with the host Ben Leo. This debate is a roller coaster. I have a select segment for us to react to, but I will link the website where I got this from so that you can watch the entire video clip. First, we will take a look at the part where they are talking about anorexia nervosa. And I'm doing this on purpose because it will show us her reasoning for thinking the way that she thinks. So, let's begin.
When you're a doctor, you should know this. You're running a gender GP clinic.
You teach me about medicine and
well, it's not a gotcha, but it's just a definition of fact that somebody with anorexia is suffering from body dysmorphia. That's what it is. I'm saying, would you offer them liposuction to make them feel better?
I think that's the most stupid question I've ever been asked. Why do you think anyone would offer somebody who is suffering with anorexia nervosa liposuction?
Well, same question
so
to you. Why would you offer somebody with gender dysmorphia?
No, excuse me, gender dysphoria.
Dysphoria. Why would you offer somebody with gender dysphoria potentially a dark pathway to permanently changing their body?
Yeah, that's because that's what they want.
Cutting off their genitals. Because that's what they want. Okay, same thing as an anorexia patient. If that's what they want, they think they're fat and they want liposuction. If that's what they want, just give it to them, yes?
No, they are completely
right, so what's
different.
The difference?
The difference is that anorexia nervosa is a very, very severe mental illness. And actually we need to be very careful.
Well, there we go. I'd argue transgenderism is a severe mental illness as well.
Really?
Yeah,
well,
of course.
You are way behind the times.
I don't see any difference.
You don't? Well, then I think you're extraordinarily unkind.
Okay.
Right. So I went and I fact-checked this because to me, personally, gender dysphoria, which I agree is a real thing, is a mental illness to me, okay? However, when I looked it up here in the UK, it is no longer defined as such, despite there being research terms that are contradictory to it from what I could find. So I got this from the NHS website, and this is what it says. Gender dysphoria and gender identity. Many people with gender dysphoria have a strong, lasting desire to live a life that matches or expresses their gender identity. They do this by changing the way that they look and behave. Some people with gender dysphoria, but not all, may want to use hormones and sometimes surgery to express their gender identity. Gender dysphoria is not a mental illness, but some people may develop mental health problems because of gender dysphoria. Helen is basing this on this practice, okay, from those definitions according to what it says here in the UK now. So let's continue on with the video clip and see what it is that they say.
And just tell us, Gender GP is going to be active in various states here in the US. Have you had any pushback from the Trump administration? Have you heard from anybody here who's got concerns about
not politics? This is about making medical health care accessible to people who need it.
Yeah, well, it's this is the front page of your website here. So be seen, skip the NHS's 5 to 10 year wait times, get compassionate, personalised, gender-affirming medications in just 2 to 3 weeks. How much do you charge people for signing up to Gender GP?
So the subscription is $29, $29.99 per month.
Per month. Is that a one-time setup fee?
Yeah.
You still got that? How much is that?
I don't know, to be honest. I haven't seen that. I don't do the logistics of that bit.
Okay. I think it's £195
that's all.
one time fee. Do you feel?
You're on that was the UK website there. I don't know where I'm on that.
Are you profiteering, Dr. Helen? Off the back of vulnerable children who have got mental illnesses. Do you ever consider that?
Makes you wonder.
Children or children who are questioning their gender are not automatically vulnerable, but this kind of conversation makes them extremely vulnerable. And transgender people are not suffering from a mental illness, and the fact that you think that or say that on television is cruel and unkind.
Again, by definition.
Right. So, children at that age are vulnerable and susceptible. They need clear and concise boundaries. The same with teenagers as well. Although there they are obviously coming more into their own minds. But by law, they're not able to make decisions for themselves with regards to health, alcohol, driving, smoking, and other age-restricted activities. So why would they be able to make a decision with this? My concern would be, given Helen's history, and please read the article that I link below should you wish to, is that the company will issue the medication without a thorough checkup and investigation as to what is actually going on. There could be something else going on in the child's life that they have lost control of that needs to be investigated and get to the bottom of, and deal with that from there. And then obviously when they get to 18, if it's still an issue, if they still feel like that, then they should go and see what it is that they need to do.
Gender dysphoria is a mental condition.
Do you mean a mental illness, or are you saying that?
I think it's a mental illness. Yeah, it's a mental illness.
Do you know one day you will have a transgender person in your life, and you'll look back on this conversation.
I don't think I will, especially not the child, because I'll tell my child, as I told Zach, my 2-year-old, he's a sweetheart. I'll say,
do that.
Zach, I love you, my boy. But today you're not Batman, you're not Spider-Man, you're not a girl today. And we've moved on. He's not mentioned it since. And I think if more people did that, instead of open, exactly, he's 2 years old. Leave the children alone.
One day,
let them be innocent. Let them.
Transgender person.
Right. So he's right, and even she had to admit that because he's 2. So he can't make that decision for himself, and she can't even go that far. It gets worse though, because shortly after this particular GB News segment, she goes on to X and she releases this particular video that I've got for you. And I think it's total rage bait, just to be clear, total rage bait. But, well, just watch for yourself.
You don't know how privileged you are.
I'm sorry if it's jumpy as well. OBS is behaving weirdly.
Your white skin, your able body, your easy entrance into rooms that others are barred from. You don't realise how privileged you are, your ovaries and womb, your birth canal, your lips that speak for womanhood, as if you own it. You have no idea how privileged you are. Your breasts, your waist, your hips, your soft, flat triangle that the world never zooms in on. You wear your body like a badge, and still you guard the gates as if anyone asking to enter must be trying to steal it from you. Your privilege should be stripped, not out of cruelty, but justice. Not to wound you, but to spare others the blade of your entitlement. The way you wield biology like a weapon. The way you deny truth as if truth were yours to distribute. The pain you have caused is immense and enormous and heart-wrenching and continuing. Not because you exist, but because you insist others should not.
Total rage bait that was. Well, here's the thing. We do own womanhood. We were born girls and we grew up to be women. We have lived experiences that trans people will never have, and I will never have a lived experience that a man will have. We are entitled to everything that is offered for women as well. The thing is, a lot of women are fine with trans people, but the language and the movement has become so radical that barriers had to be put up. And how can she not see this as a woman herself? How important that is. Well, anyway, I have a video to round off this video that I have made for you. This video is a video of a detransitioner with borderline personality disorder. Now, it's not the whole video clip, it's just a segment, but it'll be enough to highlight, well, what it is that I need to highlight.
I want to say that I really feel like some people in the trans community and the trans medicalists and the doctors really, really target the most vulnerable of us. I have borderline personality disorder, and I know for a fact that this is the reason for my transition. It's a very difficult mental illness, and one of the core features is not having any sense of self or identity, and my doctors knew this. I told them, even though they didn't ask, that I had been diagnosed with BPD, and it was all fine to them. I wasn't happy as a girl, so that meant I was a boy, and I was trans, and so I just took the cure that was handed to me. I was told that I was being given a cure, and I wouldn't want to kill myself anymore. And it wasn't true. I didn't want to cry in this video, but this is such a hard thing to talk about. I lost a lot of things to this, and I just hope that anyone else who's going through what I went through as a young girl will not be prescribed hormones and surgery because of other things. You know, there are so many mental health disorders that make you hate your body, and the solution isn't to change your body, it's to fix your brain, you know? I just don't want anyone else to ever feel this way. I lost my voice, I lost my chest. I don't know if I'm gonna be able to have kids. I feel like no one wants to date me or...
That's horrific. She's a very good example, and of someone who has suffered at the hands of inept doctors not doing their job properly. She takes the time to tell them that she's got borderline personality disorder, and they didn't even think that that could be a factor as to why she was going to them feeling the way that she did, and they just put they just operated on her. No, horrific. And the thing is, we're only going to see an increase in that. I think there's going to be a mass increase of detransitioners. I really do think that's going to happen. I really do. Let me know what you think. Chat about it, don't shout about it. Check out some other content that I have picked out for you. Thank you very much for watching. Bye bye. Thank you for watching today. Don't forget you can join me on my other platforms as well. I've got YouTube, Rumble, Spotify, X, TikTok, Instagram, Locals, Substack, and I also have a Discord. Everything is linked below.